winter series. Welcome you all for this second part of our winter series from GCSMR, Global Center for Siddha and Medicine. Last week we saw about Siddha preventive measures for this winter common cold and other sickness. This is a series about self-care from Siddha. How to care yourself in Siddha medicine, and this is our second part with the common cold. We will have a very short, brief introduction, and then we can straight away go to Dr. Silva's presentation, followed by question answer session in the last. Please mute yourself when you are not talking, so that we can clearly able to listen to what doctors are talking. Rama.
Um, Thank you so much, Tamarai. I welcome each and every one who have joined this. It's a series, like Tamarai mentioned. This is the second series, and it's about common cold. I'm not going to take a lot of time. Again, I just want to remind that Global Center for Siddha Medicine and Research is a registered nonprofit, tax-exempt organization registered in US and in India. We are doing a lot of uh, we are taking a lot of measures to take Siddha to the global stage. As I'm always saying, it is our everything is all the details, advancements, progress, and anything you need about like home remedies is available in our website. Please visit our website www.globalcenterforsiddha.org. And also, please subscribe to our YouTube channel where you can get wealth of information free. So please kindly subscribe, and you'll be able to get all the information, including this series that we are doing. It is going to be uploaded in YouTube. The previous one is already there. So if you subscribe, you will get automatically the alerts when a new video is uploaded. There's a lot of treasures that we are giving you for free, so please kindly use it. And now we are now, and also I would like to invite Dr. Selva for this series. I already gave a detailed introduction about Dr. Selva. By now, you all know him. So without taking much of his time, I'm going to invite him to start the talk. Thank you, everyone.
Thank you, Tamare and Rama, for introducing me. Just I share my slides. Take two must go together. Able to see my slide?
Yes, doctor, we can see.
Yeah, okay. Thank you for all the members. Good morning to the persons joined from India and Malaysia, and good evening to friends joining from the USA. So today we are going to talk about the preventing winter sickness series. Today's topic is a common cold. So we already see it from our WhatsApp group. So common cold, what is common cold? What are the causes, the mode of spread, and the symptoms? And the last important thing is how do we approach, or how do we manage or prevent through the integrative Siddha approach. The important part of that non-pharmacological approach are diet, home remedies, and herbal supplement, and some simple yogic practices. So what is common cold? The common cold is a virus infection that affects the upper respiratory tract, including the nose, sinuses, and throat. It is a mild, self-limiting upper respiratory tract infection characterized by nasal stuffiness, that is the nasal congestion, nasal discharge, sneezing, sore throat, and cough. It is considered to be the most common infectious disease in human worldwide. Most often, it is harmless. It is very self-limiting disease, but it might not be that way. A common cold leads to more hospital visits and absence of the work, absence from school and work than any other illness each year. So, what causes the common cold? It is caused by the more than 200 different species, different groups of respiratory viruses. Rhinoviruses are the most common cause of common cold. It is found to be the more than half of the upper respiratory tract infection each year. So, mode of spread. How is it spread? It often spread through the airborne droplets when an infected person coughs or sneezes. The common cold are also spread when someone is sick, touches you, or touch the surface you touch. The important thing is human sneeze creates a turbulent gas cloud of droplet that can travel up to 8 meters. That is very important. Evaporation time and sedimentation time are important factor in spreading of the disease. Many research papers are elaborately describe about this evaporation time and sedimentation time. So this is an important slide. These are all the factors affecting the prevalence and incidence of common cold. Crowding and sociability. The crowded place like schools, colleges, theaters, cinemas, public transports are more likely to spread the virus and spread the disease. The next important is psychological factor. That is a psychological stress is a risk factor for the common cold. The underlying factor, the many underlying factors are mentioned in the modern theories. The release of cortisol, the important hormone, cortisol hormone associated with the stress, and it can compromise the immune response, the immune system of our inherent strength, and make the people more susceptible to developing the common cold and related upper respiratory tract infections. The next factor is the sex. Women are almost twice as likely to develop the common cold compared to men. The sleep pattern is also very important. Sleep quality is an important factor for the immunity and enhancing our immune strength. Susceptibility to not only for the common cold, but for other respiratory infections and other diseases are also. Season is also very important. Nearly every important respiratory pathogens, respiratory microbes, viruses, bacteria of human being exhibits distinct seasons variations. People are most likely have cold during the fall, winter, that is starting from early September to March. This is the most common period for affecting this common cold. So at this juncture, it is important to differentiate the common cold and flu symptoms. So the cold major symptoms are stuffy nose. There is a nasal congestion, nose cold, sore throat, sneezing, cough, headache, and fatigue. These are all the common symptoms for nose cold. There is a common cold. Flu has the severe body pain, muscle pain, high fever, chills, vomiting, loss of appetite. These are all the common symptoms of flu. So differentiate from the flu and cold is very important to treat and manage ourselves. So next we are going to see the preventive measures. The first preventive measures is the tooth brushing is also very important. We already talked about the preventive measures last week. So brushing tooth with the herbal powder, avoiding the toxic toothpaste. Using herbal powder is very important to prevent upper respiratory and lower respiratory tract infection. The combination of Tribala churnam, clove powder and pepper powder. There is a, for example, 100 gram of Tribala churnam mixed with 5 gram of clove powder and 5 gram of pepper powder. This combination is effectively prevent the common cold, especially common cold, the all other respiratory tract infections. The next is the drinking Karisale juice 30 ml every day morning. If not possible, Karisale powder. Karisale is the Bringaraj in the Sanskrit. Eclipta alba is the botanical name. It is available in the US market, Malaysian, Singapore, Indian market. So Karisale powder 100 gram with the pepper powder 15 gram. This combination is also, we can prepare it in our home. Half teaspoon of this combination. There is a Karisale powder 100 gram, 15 gram of pepper powder, mix thoroughly. And from this mixture, take half spoon, mix with honey in the empty stomach. This effectively prevent the respiratory tract infection. The next one is the Amukra Churanam. In Sanskrit is called Ashwagandha. Vidania somnifera is the botanical name. The Amukra Churanam is available in the US market and Indian market. Half teaspoon of that Amukra Churanam mixed with the ghee is prevent the common cold. The next home remedy prevention is the turmeric pepper ghee. This very effectively prevent not only in the nose cold, it also prevents the respiratory tract infection, bronchial asthma, respiratory allergy, skin allergy also. The simple preparation is the 1 teaspoon of pepper powder mixed with the 2 teaspoon of turmeric powder, and both the powders mixed with 100 gram of ghee. Boil it in a low flame, allow it for cool, and store it in a clean glass. 1 teaspoon twice a day. Morning and afternoon is okay. Morning 1 teaspoon, afternoon 1 teaspoon of this turmeric pepper ghee is effectively prevent the respiratory allergies and respiratory infections. The next one is the honey ginger. Remove the skin of the ginger, cut it in small pieces and fry it in a ghee, clarified butter. Cool it in a normal room temperature and soak it in a honey. This combination, 1 teaspoon of this honey ginger early morning every day prevents this common cold. We can start from August last week to the February last week. So it prevents the respiratory allergy, not only in the respiratory allergies, it also prevents the skin allergies also. Turmeric powder and pepper powder steam inhalation. There is a 1 teaspoon of turmeric powder, half teaspoon of pepper, mix it in the water, boil it and take a steam inhalation with this. It also prevents the respiratory allergy and the cold. Kaya Tirumeni Thailam and Chukku Thailam are prepared Siddha medicines. We can use it, both the oils, as a head bath. That is a oil bath, head to toe. Allow it for half an hour and take a bath with the hot water. We can use both the oils as a nasal drops. 2 to 8 drops each nostrils. Allow it for some 10 to 15 minutes and take a bath. And in night times also, take 2 drops each nostril is also prevent the nasal allergy and the nose cold. The culinary medicine, culinary part, traditional rasam, the traditional soup with betel leaf, tipli, that is the long pepper, mint, common pepper, tulasi, Osimum sanctum. The normal traditional rasam, that is a normal traditional soup mixed with this herbs can prevent this respiratory allergy and nose cold. Curry leaf soup also enhance our immune status and reduce the stress in our day-to-day activities. The simple combination is curry leaf, shallots, that is a small onion, garlic, tomato, dur dal, turmeric powder, sea salt, pepper. These are all the ingredients of the curry leaf soup. We can prepare it the curry leaf soup once in a day, at least twice a week, can prevent many respiratory allergies. The next preventive part, the non-pharmacological approach, is the abdominal breathing. Already we know about the conscious breathing. Sit in a comfortable position. Put one hand, that is most probably right hand, on your belly, just below your rib, and the other hand over your chest wall. Take a deep breath through your nose and let your belly push your hands out. So through the inhalation, the air enters through the nose and enters the lungs, pushes the diaphragm downwards. The abdominal pressure will increase. Then the abdominal wall pushes our hands, right hand. Exhale completely in a slow phase. The maintain inhalation and exhalation ratio in 1:2 ratio. For example, inhalation 5 seconds. For example, inhalation, you take 5 seconds. Exhalation is the 10 seconds. 1:2 ratio. Pause in between inhalation and exhalation. That is the kumbhakam. 1 second is enough. Repeat this inhalation exhalation process 3 to 5 times in a starting period. You can increase the numbers to 20. Some other preventive yoga, therapeutic yoga postures are mentioned in this slide. There is a Nala Asanam, there is a easy pose. Nindra Kokkasanam, standing forward bending pose. Kulandai Asanam, child pose. Cat and cow pose. Savasanam, that is a resting pose or corpse pose. These are all calms our mind, reduce the anxiety and depressive symptoms, reduce the stress level, regulates our neurotransmitters, that is our hormonal activity. It enhances the activity of serotonin, melatonin, endorphins, that is endogenous morphine, and regulate all our internal organ mechanism and regulate our internal physiological functions of our body and prevent many diseases, not only common cold. So next we come to the management part. So the management part is the first one is the Tirikadukam. Tirikadukam means dry ginger, pepper and long pepper. Sukku, Melagu, Tippili in Tamil. The equal quantity of these three ingredients powdered separately and mixed thoroughly. It is also available in the market as a Tirikadukku Churanam. Half teaspoon of this Tirikadukku Churanam mixed with the honey is effectively prevent as well as the manage the symptoms of the nose cold. The next management part is turmeric powder with pepper powder steam inhalation, also important part of the management. Tulasi, clove and ginger decoction, that is 10 tulasi leaves, 2 clove and half teaspoon of ginger, dry ginger powder or cut ginger pieces. Mix with 200 ml of water and boil it to till 100 ml. We can add palm jaggery or honey and drink it twice a day. It will effectively manage the respiratory allergy and nose cold. Neerkovai tablet is the prepared Siddha medicine. It is very safe. It is available in the market. The 2 to 3 tablets of the Neerkovai tablet powdered and mixed with hot water or ginger juice. This paste should be applied forehead, over the nose, below the eyes, and allow it for at least 2 hours or overnight. It will reduce the symptoms of the nose cold. The next part is penicillin, the nasal drops. Nasal drops, 2 drops each nostrils. Penicillin is also effective in controlling the symptoms of the nose cold. The next management part is the tulasi leaf pepper decoction with honey. Ginger, small onion, and honey. This combination is very good for nose cold as well as the flu-like symptoms, strep throat also. So 1 teaspoon of dried ginger powder or cut ginger pieces, fresh cut ginger pieces, 2 small onion shallots, boil it in a low flame, filter it, add small quantity of honey or palm jaggery, drink it twice a day, or we can increase the dosage also. Dry ginger powder and palm jaggery powder mix thoroughly. We can chew this combination once in 3 hours is effective. Mint leaf tea, that is a mixing of mint leaf with the ginger, and we can mix with the honey. This is also effectively manage the symptoms. Traditional rasam, we already saw it in the preventive part. The Panjamutti Kanji is very effective in managing the fever, flu, upper respiratory infections, all the convalescence periods. We use this Panjamutti Kanji. The preparation very simple. Black gram, dur dal, rice, green gram, chickpeas. All are equal quantity. Take all these grains, all these pulses and grains, and wrap up them in a cotton, pure cotton cloth. Add 1 liter of water, boil with the low flame, and then after 20 minutes, take all the pulses and the porridge. The kanji is effective in the convalescent period, effective in reducing the symptoms of the common cold. Panjamutti kanji. It is effective Siddha preparation. Garlic honey. It is also useful for the reducing the symptoms. Grind the garlic. The preparation is also very simple. Grind the garlic and put it in a cotton cloth and roast it in a fire to get a juice. So we get a juice from just with a low flame, either in the gas stove or in the lamp. So equal quantity of garlic juice and honey mixed with pure honey. It is called garlic honey. Poondu then in Tamil. So 2 drops to 5 drops is effective in the pediatric usage. 1 teaspoon for adult. This is also effective management. Cardamom tea, simple preparation. 5 cardamom, dry ginger 5 grams, mix with the 200 ml of water, boil it to 100 ml. Add palm jaggery. This is cardamom tea. Tulasi leaf juice, that is a basil leaf juice, are steamed and squeezed to extract the juice. This tulasi juice 5 ml, honey 5 ml, mixed with the lukewarm water. This is also effective management part as a herbal supplement. At this juncture, I I stop my presentation and open for the question and answer.
Thank you, Doctor. So if you have any questions, please raise your hand or unmute yourself to ask Dr. Selva about your question. Please make it short and sweet so that others also get chances. Please raise your hand.
I'm seeing American Tamil media.
நான் தான் கனகலட்சுமி.
Oh, Kanagalakshmi. Yeah, okay.
வணக்கம், எப்படி இருக்கீங்க செல்வா சார்? எனக்கு புதுசா ஒரே ஒரு கேள்விதான் சார். இந்த ஜிஞ்சர் பத்தி இப்பதான் ரீல்ஸ் உலகத்துல எல்லாருமே போட ஆரம்பிச்சிட்டாங்க. அவங்க இஷ்டத்துக்கு ஒண்ணு அட்வைஸ் பண்ணிட்டு இருக்காங்க. இந்த ஜிஞ்சரோட தோல் நல்லதுதான், எதுக்கு நீங்க வந்து ஜிஞ்சர் தோலை சாப்பிடாதுன்னு சொல்றீங்க அப்படின்னு கேக்குறாங்க. அந்த ஒரு கேள்வியும் மட்டும் எனக்கு இருக்குங்க டாக்டர்.
ஓகே, இதை பத்தி எலாபரேட்டா ஒரு வீடியோ பண்ணிருக்கோம். I will share that video. So remove the ginger. As per the classical Siddha literature, the ginger skin is the toxic. It is not compatible to our system. Our fundamental tissue, part of our body, 7 fundamental tissues are there. The fundamental to our system is the 5 primordial elements. Panjabhutangal, man, neer, thi, kaatru, ahayam. So incompatible to our system, we just avoid all these things. So they remove the skin. Injikku purananju, kadukkaikku ahananju. I will share the videos and that for all of you.
Thank you, Doctor. Other informations are very useful. Thank you for taking your time and giving us the information. Thank you.
Thank you. Thank you. Thank you.
Thank you, Doctor. Next.
You can also post your questions in chat. I think the first question is from Tini.
Yeah, Tini, I'm seeing it. Yeah.
Yeah, I have my right nostril block. How do I get it better? And for knee, any remedy?
Okay, nostril block, we use the homemade preparation. So there is some non-pharmacological approaches. Steam inhalation, plain water steam inhalation, or if you have any mint leaf or tulasi, Osimum sanctum leaf, or turmeric powder with the pepper powder, or neem leaf inhalation, it is useful. And apply the nasal drops, the Chukkutailam or Kayathrimani Tailam or Penisatailam. If you are not able to get immediately, you prepare a simple oil, herbal oil, mix with there is a simple preparation, 100 ml of there is sesame oil and 1 teaspoon of, able to hear?
Yes.
Yes, okay. So 100 ml of sesame oil, 1 teaspoon of pepper powder, 2 teaspoon of turmeric powder, and boil it in a low flame, filter it. That oil you can use for hair oil as well as the nasal drops. So steam inhalation followed by the nasal drops is useful, prevent the nasal congestion during the winter season. Also use all the home remedies mentioned in our discussion. The knee pain, there is the root cause. We also know what are the cause for the knee pain. We have plenty of remedies there. We will discuss in some other time. Okay, it is related with the common cold.
Okay, Doctor, I think we can see it at the end again, and also about the Varma. Someone has asked about the Varma therapy in Manipal. I think Dr. Arulamudan can. Yeah, in the end, but we will go with the common related cold questions first.
Yeah, someone, Lada, when is the best time to drink Panchamukhi Kanji? She's asking that question. The chart.
Panchamuti Kanji is the daytime. From morning 6 a.m. to 6 p.m. is the ideal time. You can drink any time in the daytime.
So the next one is Vimala Rani. There has been some literature to use onion or garlic put on the feet of babies to reduce the pelgam. Can you please advise on this? Thank you.
Which one? Just repeat the question, please.
Vimala Rani's question. There have been some literature to use onion or garlic put on the feet of the babies to reduce pelgam.
Phlegm.
Okay. So we usually don't advise the direct application of the onion or garlic in the pediatric usage. We can mix with this onion or garlic, mix with the coconut oil or sesame oil, boil it in a low flame, filter it. That oil can be used for application in the is advisable. Don't use direct usage for babies is not advisable.
So Raji Mages, this is the first session for me. For ginger syrup preparation, do we have to leave the white residual at the bottom and take only the top?
If you use the ginger juice, this is the correct method. There is a residue. Don't use the white residue. Use the thin fluid, that is the only the juice. If you use the decoction, we can crush the ginger and take a decoction and filter it. We can use. For the juice purpose, this is the correct way. But in the syrup formation, we are using the whole ginger part and mix with the other herbal part and make a decoction, and we can use the syrup.
Any other questions?
Yeah, the PPTs and the videos are available in our YouTube channel. Actually, a lot of people are asking about the remedies and a lot of questions which are related to this web series and a lot other information. As we already mentioned in our meetings, there are tons and tons of wealth information is available in our website. Just for a quick glance, I can share the website and show you what is all available. Okay, can everyone see our website?
Yes, able to see.
Yes.
Yeah, this is our main site, and it's about what's our mission, vision, and what is Siddha and all these things. And it's about the projects that we are doing, that Manipal project and Primary Health Center project in India, and also our webinars and other wellness program that we have been doing around USA. All this information are available, and especially the Manipal ones, you can see more about the Varma and other courses that's available. And also with the affiliation part, we have put a lot of information about our affiliation with the Manipal Academy of Higher Education, MAHE, and Varma courses that been available there, and also our affiliation with the Moorhouse School of Medicine. And recently, like few students went from MSM to India to learn Siddha, and other the medical students, they went there. All this information are available, of course, about Health India Foundation. And when you go to the services, there are so much of options are available. You can see health webinars, wellness coaching, wellness workshops, and women's well-being, all these things. In health webinars, if you go and click it, there are so many videos of our health webinars from GCSMR. And these are the topics that we did, like COVID, obesity, allergies, mental health, women's health, pediatric health, heart health, Varma therapy, and so many of these videos are available. You can go and click all those. The whole videos are there, so you can go and watch it, like whichever is interesting for you. And also the food as medicine. If you go to the food as medicine in the top bar, you can see the like herbal plants, home remedies. So these herbal plants we have comprehensive detailed videos of all the herbal plants that's available here in USA and how to grow those herbal plants. These are very common herbal plants like tulasi, sembarati, and aloe vera and karisale, all these things, how it's grown here and how can it be used. So many good videos are available with the affiliation with American Tamil Radio. And also all these simple recipes that doctor has been telling us now, it's also available. I think except one or few like this podi and other things may not be available here, but we will add those. But that herbal oil, black green porridge, and sukumali drink, adumaduram drink, garlic honey, how to prepare it, everything is available here in the like simple preparation and food as medicine, simple recipes. And also about millets. There are so many information about millets, Sirudhaniyangal. What do you call that in Tamil and what's the English name for it? And how can be used? Not all millets can be just boiled and consumed. It has to be prepared in the correct way, and it has to be taken. So all this information is available here in the millets thing. So if you go to food and medicine, there are so many things are available here. So you can refer that. And also, like if you go to the events, past event, like all our webinars and other things are available in the upcoming and past events. So you can watch those things. And in media, we have a separate pages for Dr. Selva Shanmugam and Dr. Arul Amudan, and also about articles about Siddha and American Tamil media, where we had a lot of this series, herbal series and health related series. So you can go and watch that, and especially the one Dr. Selva Shanmugam pages, we have all those videos that he has been given in various Tamil medias and social medias like Vigadan TV and News 7 channels and all these things. So these are the small clips of those reels of those many interesting videos. So you can work that. I think he has also talked about using ginger with or without the skin. So there are so many very interesting topics are available in the videos, and you can refer that. And also in Dr. Arul Amudan page is his write-up and all these things about his work in Manipal and other things, and his parallel session workshops and everything in Fitna. So these are so many, and we have a separate thing for Varma. What is Varma and what are the Varma courses available in Manipal? So whoever interested, you can go and see our website. That we have recently revitalized our website and did a lot of new addition in our website. So please go and refer those things. And if you have any questions, please don't hesitate to call us for anything. Or there is a WhatsApp group, and you can see those QR code in the flyer. You can join those WhatsApp group or email us. We have already shared our email address and website in the chat. You can go and visit us or join our group. And the next week also there's the next third series also is also coming. So you can go and watch all these things. We will keep informed every week. I've been sending a lot of information about this web series and other things. Please contact us if you have any questions. Thank you. If you have any questions, please raise your hand or put it in the chat.
There's one more question by Nalina. Is mustard oil application on feet help fight cold?
Yes. It is 2 to 3 ways we can use the mustard oil. If you are not able to get the sesame oil or coconut oil, we can use the mustard oil. Mustard oil steam inhalation. There is a few drops of mustard oil in the boiled water. We can use this the steam inhalation, and boil it with the tulsi leaf. There is a turmeric leaf, turmeric powder or tulsi leaf. We can apply it in the feet. It can help to reduce the respiratory allergy and other things. Yes, we can use the mustard oil.
So one more question I want to share with you, sir.
Yes.
அந்த ஆமணக்கு எண்ணெயை வந்து தொப்புல தடவிக்கிட்டும் போது குளிர்காலத்துல சளி பிடிக்குமா, அவாய்ட் பண்ணிக்கலாமா? அதுக்கு பதிலாக நல்லெண்ணெய் தடவிக்கலாமா தொப்புல வயிற்று புண்ணு இருக்க?
அந்த குளிர் சமயத்துல, அதாவது குளிர் சமயத்துல வயிற்றுல பிரச்சனை இருந்ததுன்னா,
ஆமா சார்,
அந்த சமயத்துல என்ன பண்ணணும்னா சின்ன வெங்காயத்தோட கலந்து காய்ச்சி அதை பயன்படுத்துங்க. அல்லது நல்லெண்ணெயும் மிளகும் சேர்த்து காய்ச்சி தொப்புள்ள போடும்.
வாய் புண்ணா இருக்கு, வயிற்றுல இருந்து வாய்.
அதர் ரெமடிஸ் நிறைய இருக்குது. நம்ம அவங்க மிஸ்ஸஸ் தாமரை சொன்ன மாதிரி நீங்க வெப்சைட்ல பாருங்க. நிறைய உளுந்து கஞ்சி அந்த மாதிரி நிறைய சொல்லியிருக்கோம். அதெல்லாம் பண்ணிக்கலாம், யூஸ் பண்ணிக்கலாம்.
ரொம்ப தேங்க்யூ சார், தேங்க்யூ வெரி மச். வாழ்க வளமுடன் சார். You have given the opportunity. Great, thank you sir.
Thank you so much. Thank you.
Next.
This is Siva Sailam. This is my president, Selva, Tamarai, Ramamani, Jebalan, Roman Andri. You did a good job. And please spread the word, all the audience, about the upcoming. There is going to be 3 more webinars that are coming up. So try to attend whenever you can. And thank you very much. And wish you all a happy and healthy New Year.
Thank you.
Thank you very much.
Thank you. நன்றி வணக்கம்.
If there are no questions, we can wrap up. Do any of you have any questions?
Any questions?
So
Only
we can...
wishes, sir. Wish you happy New Year. All blessings, sir. This is all I want to share with you. Thank you very much for your humanity service.
Thank
Great
you.
service, sir.
Thank you. Thank you very
Warm
much.
welcome. Okay, sir. Thank you very much. His
Someone
humanity service
asked
very
about
well kept.
Yeah, someone asked about the Varma course.
Yeah, Dr. Arul can.
Dr. Arul, are you there? Could you answer the question?
Yes, sir. Just
Venkat,
can you tell us what?
Could you mute yourself, Venkat?
Yes. Thank you.
Dr. Arul, there's Usha asked about they are interested in Burma therapy for back pain. Can we schedule a time at Manipal Hospital? How many days of treatment are usually recommended?
Yeah, actually we are in Manipal, which is Manipal Siddha chair, which is established by Global Siddha Medicine and research. There we are using the Varma therapy in an extensive way. So the full-fledged Varma therapy is used. So patients can come any day except Sundays and the third Saturday, and all the Sundays are holidays. Any day they can come. Even they can contact me and come, or directly they can come here. There are 4 doctors are there. They are Siddha doctors trained in Varma therapy, and depend on the problem. Like if there is a disc bulging, disc prolapse, or only just lumbar degeneration. So based on the condition, we will schedule how many days it is required. If it's a simple muscular related thing, only 3 days or 3 days Varma therapy is enough. Suppose if there is a disc involved, disc bulging, prolapse and all, then 6 days, 1 week Varma therapy every day has to be done, followed by medication. Oral medication also we have to give for some more days, so that the problem will be permanently addressed. So if it's only muscular or other sprain, or after any post-traumatic related pain, then 3 days Varma therapy is enough. So just we will check the pulse also, Nadi based. We will decide the treatment based on the Nadi. How much Nadi is affected, that many days treatment is required. So 3 days to 6 days minimum they have to be here physically. After that they can leave home after carrying the medicine, then there they can continue the medication.
Thank you, Dr.
Arul, can you also elaborate a little bit on the courses at Manipal? Thank you.
Yeah, so here we are conducting 3 different type of courses. So the first course is introductory course for 1 month. So anybody, public also, anybody interested, they can come. 1 month they have to be here, and within 1 month we will teach you basics of Siddha and Varmam introduction, basic introduction. With that you can do few of the like your own self healing and for your family. That is the simple introductory course. The second thing is the 6-month full-time Varma therapy course. That is meant for the health professionals who have done undergraduate in medicine or Siddha or Ayush, or therapies like physiotherapy, chiropractic, occupational therapy, yoga therapy. They are eligible as a postgraduate certificate course. That's for 6 months full-time. Another third course is the same professional for the professionals, but it is in hybrid mode. So it is a 1-year course in hybrid mode, where weekly they will attend the online course on Wednesdays evening 5:30 to 7:30 Indian time. After that there are 5 times they have to come to Manipal for the practicals, 5 second Saturdays, Sundays, alternate month, to complete the practical sessions. And at the end there will be exams, and 1 week internship is there. After completing everything, they will get certificate. In case if the candidate is a NRI candidate and from abroad, they can take the same hybrid mode course. They can attend the online class at the same time along with the other students, but they have to come 3 weeks continuously at the end of the course to complete all the practicals, exams, and 1 week internship together. They cannot travel frequently, so that NRI candidates can come at the end of the course. 3 weeks they have to be here in physically in the Manipal. So this is again for the professionals, health professionals who have already done health related courses. They are eligible. For the public, 1 month course, 1 month like a group as a family, you can come, friends together, you can come and you can take part the course, and you learn like for your house, for your personal and family members, how much you can use for yourself health care. That is covered in the 1 month course. For any doubt is there, you can contact me by email or by phone. We have given the contact email also in the website. You can contact us, or you can contact GCSMR also. They will connect to me.
Thank you, Doctor. I've been sharing the screen. You can see the postgraduate certificate course, Siddha course in Varma therapy course in Mahe. We have all this information posted in our website. So you can contact us any time for these courses and how it's available, how it's we can apply. And also we have this at the bottom line here, you can see the YouTube channel. So if you click that, there are a lot of YouTubes, all the webinars are recorded, and the YouTube links are available here because a lot of you are asking, a lot of people are asking like about how do we see the videos. Even last week video, like people are asking about that. It's very simple. You go and click the YouTube icon here and you can see all the webinars from GCSMR and about even the Varma and everything is available in our YouTube channel. You can go and click there and see. And the next week is about influenza, flu, and after that is about strep throat, and after that is about acute bronchitis. So the next week is January 5th about is influenza flu, and January 12th is about strep throat, and January 19th is about chest cold. So this series will continue the same day, same time. And also we have listed the timings in each flyer, timing that is for India timing, USA timing, and also Malaysia timing. Please refer that. Some of them, they got confused and they were logging early, but I told them the correct timing is listed in the flyer and also in the WhatsApp groups. So please refer to those timings. And US time, it's always Sunday evening at 8 p.m. Eastern Standard Time, US time, and India Monday morning, India time. So you can refer that. So please pass this information to all your friends and relatives and groups who can join and benefit from this our webinars. We have been conducting this for a while. And also thanks to our GCSMR president who's in India now. He has joined this session. So pass to all the information to your friends around the globe, wherever they are, they can join this. And if you have any suggestion of any health topics that you want us to get or do the organized topic, please let us know. I think I got a feedback from someone saying that they need women's health about menopause. So please feel free to contact us. Any health topics you can suggest to us, so we can arrange for a webinar on that related health topic. Any more questions? And also we have a WhatsApp group. You can join those WhatsApp group. The QR code is given in the flyer. So you can just scan it and join our WhatsApp group or email us. The email address is also given in the chat. You can email us anytime. Raman, Jayabalan, do you have anything else?
No, I have
No, Tamre.
no Tamre. No.
We can wrap up.
We can wrap up, yeah.
I take this time to wish you all a very, very happy new year. We'll see you back next week, the same time. Thank you very much.
Thank you. Thank you, everyone.
Thank you so much.